Hi everybody, this is Dr. Aydin
And Melissa.
at Aydin Plastic Surgery. We're excited to come to you live on Facebook and Instagram to answer a few questions from our audience out there. And this is going to be educational a little bit, and these are common questions that we see in our consultation. So here we go.
All right, so our first question is from Megan, and she asked, does strenuous exercise cause fillers to dissolve faster?
Megan, thank you for bringing this question. It is a question that we see every day from our patients. There is no scientific evidence as far as fillers, and these are mostly hyaluronic acid fillers that we use, as to whether or not they're going to be dissolving more exercise. Sometimes we anecdotally see with Botox patients that if they have high metabolism, that the Botox can be not quite as long lasting, but as far as the hyaluronic acid based fillers, which are Juvederm and Restylane type products, there's really no scientific evidence that they're gonna dissolve faster.
Cool. And our second question comes from Elizabeth, and she asked, I have had breast implants for 10 plus years. How long do breast implants last?
Another great question. Thank you, Elizabeth. It is somewhat of a myth to say that they're only going to last 10 years. The most common misconception among patients when they were getting breast implants was that every 10 years I would have to change them. What we tell most of our patients, as far as the implants rupture rates, and these are being the newer silicone-based implants, are at 10 years is probably in the range of only 20%. That means 8 out of 10 patients out there who have silicone implants do not have a rupture. Now, what I tell most of my patients is that if you are happy with the shape of your breast, if you're happy with the size of the breast, and you're not having significant pain and your capsule feels soft, at 10 years it's not a knee-jerk reaction. The recommendations from the FDA is that if a patient gets breast augmentation with silicone implants is to do an MRI at the 3-year mark and then every 2 years after. Having said that, randomly most patients do not do MRIs. So if you come in at 10-year mark, you're telling me you're happy with the shape of the breast, you're happy with the size of the breast, your capsule is soft, the implant itself feels okay, then it's probably not going to be to recommend to change them. But if any of those aforementioned complaints are there, then we probably would recommend some surgical intervention for you. As far as silicone implants, there is a slow leakage that occurs with the saline implants. But if you feel that your volume has been retained and it's been 10 years, then the recommendation will be to do nothing from that perspective. But if you feel some deflation that occurred, and sometimes it's asymmetric, one side may deflate more, the other side may not deflate as more. So if there is that kind of volume changes, then perhaps changing the implant will be necessary.
Awesome. Last question is from Melissa, not me. I am 36 years old, and I've noticed that my face is starting to sag. I actually think I'm starting to get jowls. My friends say it's not that bad, but I see it and it's really bothering me. What are my options? I'm scared that I will need a facelift in a few years. Please help.
Well, Melissa, we feel your pain, and we're here to do free consultations for you if you'd like to come in. Generally, what we tell patients that everyone is born with a different set of genes, and that exposes them to different environmental factors. So we age based on our genes and how the environment interacts with our genes, and which is true with every illness and disease out there as well. So it is possible for a 36-year-old to have more jowling than the next 36-year-old, depending on one's sun exposures, whether they're smokers, whether or not they've had weight gain, weight losses. That skin laxity may not be as good among all of us. There are non-surgical, meaning without surgery, interventions that we can do to help improve on the jowls. We do a comprehensive skin exam on every patient that comes in. That means we look at the way that we age, and we age in multiple ways. We age with the skin, how it damages from the sun, and any other factors such as smoking. We look at the way that we lose volume. As we age, we do lose also some volume in the face. The fat compartments in certain parts of the face do change. Addressing those will help that aging process. We also lose elasticity, so the skin itself, basically based on the way the gravity works on it, will fall, descend. So those are things that we try to intervene to improve the patient's appearance. So addressing one out of those three may not be sufficient to make our skin and face glow. Everyone deserves to look their best. And our job here is to give you those options and be able to explain the different procedures. There are times where surgery may be the only great options, but sometimes we don't always have to do the great best option. And for someone who wants to do be less invasive, those are options that are available. Botox and fillers are probably some of the most common ways that we intervene in the upper face. In the mid and lower face, we have other things that we can do besides the fillers. Botox is commonly not used in the lower face. So we have skin tightening measures such as the lasers and radiofrequency. So you have many options that you can go through. Well, this was our live session for this week. We're very excited to come live to you guys, and we're waiting for more questions to come back next week.
Thank you.
Bye-bye.
Thank you.